Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. When you ask people to point to their hip joint, it's very interesting to see the vast number of places where people point the low back, side of the pelvis, front of the pelvis, and the groin, and more. If one were to draw a line between the back and the front pocket, that's basically the hip joint. So keeping the hip joint in mind, picture the squat exercise. According to Dr. Stuart McGill, director of the Spine Biomechanics Lab at the University of Waterloo, Ontario, Canada, to safely perform a squat, you must first consider genetics and the role it plays, especially in performing a deep squat. Genetics, according to Dr. McGill, helps us determine whether the hip joint can handle squatting. For example, genetically shallow hip sockets can predispose people to hip dysplasia, which is arthritis. And the highest rate of hip dysplasia in the world is in Poland. As individuals of Polish descent are genetically predisposed to develop shallow hip sockets. However, because of these shallow sockets, the range of motion of their hips prior to dysplasia, of course, is greater and more powerful in the deep squat position. So it should not be surprising that the great Olympic weightlifters come from Poland, Bulgaria, and the Ukraine, which is due in part to this uniquely shaped and shallow hip joint socket. It's called a Dalmatian hip, in other words. In contrast, the shape of the hip of those of Scottish descent is deep, which has a great advantage for walking, standing, and rotation power. But the deep sockets are terrible for producing power at the bottom of a deep squat. Similarly, Celtic and French populations have deep sockets, and that's the most logical reason why exercises that require a wide range of motion, like yoga, can result in impingement pain in a high percentage of people of such ancestry. So, how does this relate to hip pain? Depending on your genetic makeup, if you're one of the descent where shallow hip sockets are common, it might be best to avoid deep squats and or occupations that require a lot of weight bearing and bending over, especially those with heavy lifting. Even though you might win a squatting competition because of less hip impingement, the shallow sockets tend to wear out faster. And the bottom line is, when engaging in an exercise class or running, cycling, or the like, if there's pain or a bad or sharp lancinating pain, for example, don't do that exercise. Stay within reasonable pain boundaries, and you should generally be safe. Don't try to keep up with the person next to you, as they may be genetically better matched for the activity that you're engaging in. And as always, make sure you get your hips and pelvis checked on a regular basis chiropractically and get it adjusted so that you get the optimal positioning and function out of your joints. Check us out at newhopechiropractic.com and have a very healthy day.